Hello everyone, welcome back to fascia training for shoulder pain part 2. Poor posture, tight chest muscle, tight biceps and restricted joint range of motion and very little mobility at the joint area will cause shoulder pain. So today we're going to do fascia training. So we'll work on those fiber, the collagen around that area to help you to take away some pain. What we need today, a yoga mat, because we're going to lay down on the floor later on, and we also need a stick. Okay, it doesn't matter what kind of stick that you have. You can actually use a broomstick, you can use a mop stick, anything that you can actually hold on to it later on for the mobility training. You also need a peanut ball or a dual ball. If you don't have a peanut ball, you can use 2 tennis balls. Put 1 tennis ball into the sock, tie a knot, and then you put the second one into the sock and tie the knot, and you get a dual ball. You also need a massage ball. If it doesn't have any massage ball, use a tennis ball, that is fine. Today we also need to use a mini roll. If it doesn't have a mini roll, it is okay. You can actually use a small liter water bottle. If the bottle is too hard for you, just wrap around with a towel and that will help. Okay, you also need a yoga block. Again, if you don't have a yoga block, that is okay. You can actually use a small little stool, and the stool usually a little bit hard and it's a little bit slippery, so you might want to put a layer of towel on top of your stool before you use it. Okay, so if you have all these equipment ready with you, we can start the workout now. So let's pick up the massage ball or a tennis ball. Now, if you still have a lot of pain at the joint area, I would suggest you lie down in that supine position with my cat also lying down there. Okay, so lie down in the supine position. So imagine my left shoulder have a problem, so I'm going to put the ball on the left side of the shoulder, so in between of the joint and your chest muscle, because when you have tight chest and tight bicep, it will affect your shoulder. So you put it at not massaging onto the bone, so you're going to massage around the muscle, the soft tissue, so you go clockwise. So put some pressure on it when you massage it, and the other hand on the arm should be completely relaxed with your palm facing up towards the ceiling, and you can do anti-clockwise, and you can rub up and down, forward and backward. So we're going to do this for 1 minute. Okay, for those who are good, you're going to turn around so you can use the block. So I'm going to put the block down on the floor and the ball on the block, and you're going to let your body weight do the job for you. So we're going to lie down, take a long deep breath first, inhale and exhale, and let your body weight sink into the ball. Now, if you feel there's some achy feelings, there's some tension there, hold it there for about 10 seconds. And once your body adapts to it, you can actually work with it by moving your arm up and down. And you can also rotate, inward rotation, outward rotation. Good, so we're going to do this for about 1 minute to take away that tension. Good, so after the 1 minute, you're going to work on your bicep. So you're going to move the block slightly away from your body, so your palm is facing down. So you're going to move up and down. Sorry, you're going to turn the block. So you're going to move your arm up and down for your bicep muscle. So do it for about 1 minute. Now the next thing that you want to work on is also your wrist flexor and your wrist extensor, because it's all linked. So if all these are very tight, you might also cause shoulder pain. So I'm going to put the mini roll on the floor with a mat or a towel. So I'm going to place the palm on the mini roll, and the other hand will apply some pressure, and you roll up and down into those fingers, and make sure you spread out the finger when you work on it. So same thing, you're going to do this for about 1 minute, and you're going to turn around and work the dorsal part. And for 1 minute, and you're going to turn this around. Okay, so you can actually rotate and work on it. Good. Then you're going to work on the wrist all the way up to the elbow. Good. You can turn around. So you work the extensor, you work the flexor. So you keep going around for about 1 minute. And then next, you're going to get a little bit of mobility around the joint area. So you get down into that 4-point position. So your wrist, your elbow, your shoulder actually form a straight line. So spread up your fingers and move your body forward and backward. So basically you will see flexion and come back with a little extension in there. So it's not a full extension. So forward, you feel the stretch, and you come back. And then you move toward to your right and to your left. And now you're going to draw a circle clockwise direction. And then you will the other way around, anti-clockwise direction. Good, so we're done with this. So one hand at a time. So I'm going to turn the arm around. So you're actually in flexion. Your palm should be facing up towards the ceiling, so press the dorsal down towards the floor. So depend how flexible you are. If you can't go that deep in, that's fine. So work at a range that you feel comfortable. So you want to make a fist, and then you release. Now some of you might have difficulty bringing your fingers into your palm, that's fine. So you start somewhere around here. You should feel a lot of stretch, and then when you're ready, you go into deeper stretch. So you start with one hand, and then you go over to the other side, and you repeat the same thing on the other hand. Good. So we're done with that. So the next one, we are going to get up and pick up this peanut ball. So I need you to adjust your body position. So now what I need you to do is to place the peanut ball somewhere around your trapezius, so your scapular area. Your scapula is actually belong to the shoulder joint. So once you find the scapular bone, so in between of the bone, okay, and the peanut ball will sit very nicely at the border of your scapular bone. So what I need you to do is support your head by using your fingers. So you rest your head on your fingers so that you're not going to strain your neck. So you actually look at your own kneecap instead of looking up towards the ceiling. So you hold it here. You should feel some tension somewhere. And if you find the tension, hold it there for about 10 seconds. And then you do a crunch. Just do a small little crunch. And you can feel all the massage around that area. So you round it back. And then you drop, keep dropping, keep dropping, keep dropping. So you actually arch your back just a little bit, but not purposely going to arch your lower back that high up. Just relax yourself. Let the gravity do the job for you, and then you round it back and look at your own belly button, and then you go back up. Good. Do it for a few rounds, and hold it up there. So what I need you to do this time, slowly lower down your head to the floor, extend both hands up. Now again, you're not doing anything. Let the gravity do the job for you, and let your hand drop down for a while, and you should feel a lot of tension around the scapular area. So let it hold it there for about 10 seconds, and when you're ready, raise your hand. Okay, just focus your breathing. Inhale and exhale. Take your time to do it. And extend, reach up as far as you can and up to the ceiling. Good, so you're going to move your hand to the right and toward to the left. So naturally your body will rotate a little bit toward to the right and toward to the left, so you can feel a very deep stretch into your scapular area. Okay, good. Now open up your hand to the side. Hold it here, 10 seconds. It's a lot of tension there. And then you reach up and open up your chest and let it drop. So your chest is open up, your shoulder is open up. You reach up and then you open up and let your arm drop down to the floor. Relax. Good. And then you reach up. Just repeat this for a few times. Okay, you can do for 5. You can do it for 8 reps or 12 reps, up to you. Because every time when you do it, you will get better and better. Good jobs. Okay, I'm going to get up now. So you're done with that, and I'm going to put this away. Good. Now next, coming up, let's pick up your stick. Okay, whatever stick that you have that is fine. Just make sure the stick is not too heavy, otherwise you start using your deltoid muscle to lift the weight up, so it should be really tight, really light. Okay, let's hold on. Okay, for fascia training, usually we go grab and hold the stick in this way. But if your stick is too long for you to do this, you have no other choice. Yeah, you can hold on to it, but preferably we want your stick to be at the palm area, and so that your finger can be completely stretched out. Okay, so we start something really easy first. Okay, if you have a lot of pain, you might not be able to raise your hand very high up, so stretch out your fingers with some tensibility. So stand up tall and slowly raise your hand. Now if this is your maximum range and this is the range that you can go, just work up to this range. Okay, so every time when you do it, you should get better and better, and you should be able to go higher and higher. So let's take it as your shoulder have get better. So we're going to raise your hand above the head. Good. Now I need you to keep your scapular shoulder down instead of lifting up your scapular bone. So in other words, when you raise your hand, you don't want to strap your shoulder up. So I need you to keep your shoulder down when you raise your hand. Good. Now, slowly, gradually come up so your hand will go to the side of your ear. And when you get better, you can actually have your hand even higher and a little bit towards the back. So when you move your arm towards the back, you should feel a lot of stretch. Now one thing I want you to take note, avoid that hypo-extension when you move your hand towards the back. So I need you to keep your stomach really tight and lift your arm. The movement should come from your shoulder joint rather from your spine. So do this for a few times, and it depends how far you can go, so you always work at pain-free range. Good, so you can do it for about 8 repetitions to 12 repetitions. If you think that you can do 15, go ahead to do 15. And the next one is to push your hand out toward to the side. So when you go easy, the movement will come from your shoulder joint, and you get better. Sometimes we can actually go with some flow. You move your body, legs wider, and then you drop to the side and push side to side. Okay, so find one range that you feel good. You can just do it in this way, or you can add a side lunge. Good, so look up. Good. So do it for about 8, 12, or 16 repetitions, up to you. Okay, so we are working in the front. You can also work from the back. So when the shoulder gets better, you can actually put the stick behind the back in this way, and you're going to push side to side. Okay, again, work on your pain-free range. You can go higher. Go ahead. If you can't, stay low. Good. So do it for a few reps, and when you're ready, your shoulder is ready, it's really warm. So we're gonna go side, 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 and you go around. And then push side, 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 and you go around. Okay, so it's a rotation. Don't have to go fast. If you find that it's too hard for you, you can go slow. That's fine. Okay, so always find a speed that you feel comfortable because it's your own workout. It's your own body. So you find a range that you feel comfortable. Doesn't matter how many times you are doing, as long as you complete that exercise. Okay, so that's the mobility of the joint area. Good. Next one. Fascia require a lot of swing, so you can actually swing your arm. We did this last week, so the moment you relax your shoulder and you just push your hip forward and your arm will naturally swing forward. So if you want to do a forward swing, you push your hip forward, you swing forward. Now if your shoulder have got better, so you throw your arm higher, so you push your hip furthermore, and your hand should go higher. And when you're ready, you can add in a tricep stretch. So do it for 16 reps if you want to. You can do a little bit more if you want to. So now it's a swinging forward. I'm going to swing backwards, so I push back. So my arm will go back. So I need you to open up your chest when you throw back. So adding a rotation of your arm. So look at my hand. I'm actually doing an inward and outward rotation when I swing back. Good, so this is when you have no pain. You can go into a deeper stretch, but if you have pain, work with a smaller range of motion. Now, if you have completely no pain, okay, you can start using a wrist weight, okay, some weight that actually go around your wrist. Make sure it's not too heavy, somewhere around 1 kg, and you let the gravity do the job for you. So you actually push forward, and the weight will actually pull your arm forward when you want to swing forward, swinging backwards. So throw your body weight to the back, your arm will naturally go backward. Okay, you can also draw a circle. So just move your body and your arm will just go naturally and clockwise and anti-clockwise. You can even draw a figure 8 if you want to. Okay, so we're done with all this, and make sure you also adding some of your fascial stretch. Okay, one way that we done it last week is you use the wall and turn your body away and with inward and outward rotation. Okay, today we can actually do it in that prone position. So you have your arm open up to the side. Now what I need you to do is look down the floor. I'm going to turn to my right. So I'm going to pick up my left leg and move my left leg backward. So my hand is still on the floor. So I actually look up towards the ceiling, so I have a stretch on the right side. And then I come back, and then I do the same thing over to the other side. So we are not holding the stretch for fascia. I'm actually doing dynamics movement, so I keep rotating my body. When you're ready, I'm going to turn my palm up, turn my palm down, and turn my palm up. So I keep turning my hand, and then you're going to move your hand a little bit higher, and turn, and come back to the other side, and turn, keep turning. Okay, so there's some inward and outward rotation when you do a crossover during the stretch. Good. Next one will be your bicep. So if you have a very tight bicep muscles, it will also affect your shoulder joint. So how do you stretch the bicep? So what I need you to do, I need you to have your hands open up with a thumb up position. Now from here, you rotate your hand forward, your thumb pointing forward. Now your thumb pointing down to the floor, your thumb will point back, And now your thumb will point up, and you're going to move your hand backward and push up toward to the ceiling and keep pushing. So you're doing a fascial stretch around your bicep brachii. Okay, do it for about 1 minute and relax. Good. So we're done with fascia for shoulder pain. Thank you for attending the session, and I see you again next week for another session. Thank you.